Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. It's well documented that as we age, most people experience a decline in kidney function, as the kidneys are one of the fastest aging organs in the body. Now, the decline in kidney function usually begins around age 30 to 40, but it really can accelerate after age 50 to 60. Researchers at Johns Hopkins University estimate that more than 50% of people who are 75 years of age and older have clinically significant decline in kidney function, and many don't even know they have the problem, but they're walking around with mild insufficiency of kidney function or chronic kidney disease, which is a major risk factor for having a heart attack. According to the National Kidney Foundation, kidney disease kills more people each year than breast and prostate cancer. Now, of course, advanced or end-stage kidney disease, if it gets that far, is a very serious matter requiring dialysis or even a kidney transplant. So if you're planning to live a long, healthy, functional life, you have to have a plan in place to preserve your kidney function as best you can, as the aging process can really impact it in a negative way. It's a very vulnerable organ. Now, risk factors for kidney disease include high blood pressure, diabetes, having a history of kidney stones, a family history of kidney failure, prolonged use of over-the-counter pain medication, this sort of analgesic nephropathy that can occur from using all kinds of anti-inflammatories and painkillers, and just being over the age of 60. And patients with certain autoimmune conditions are at increased risk for kidney damage and a decline in kidney function. Now, in recent years, what has become really apparent is the fact that free radical damage to the kidneys and the kidney structures is a main contributor to the decline in kidney function that we see in aging and in various health conditions like diabetic kidney disease and autoimmune conditions that affect the kidneys. But just the aging process alone, free radicals accumulating over time are damaging those cells. A large 2012 study showed that higher blood markers for free radical damage were strongly correlated with the rate of kidney decline as the aging process occurs. This means that higher free radical concentrations resulted in a faster decline in kidney function in the aging process. The studies also show that the kidneys are heavily reliant on the antioxidant known as glutathione to protect them against free radicals, as well as the release of kidney-damaging inflammatory cytokines. Now, unfortunately, as we age, our glutathione levels decline, which appears to be an important factor in the more rapid decline in kidney function that we typically see as people get older. So the good news is that this can be prevented or reversed to some extent using targeted dietary supplements. Now, in line with this thinking, a number of studies have been conducted in recent years to assess the value of providing patients with existing and like acute or chronic kidney disease with supplements that are known to increase glutathione levels in the body. For example, a large review paper published in the American Journal of Translational Research in 2021 concluded that providing patients with chronic kidney disease with the supplement known as N-acetylcysteine or NAC improve their kidney function over time and reduce their risk of heart attack and other adverse cardiovascular events. That's hugely important. There are no drugs that can do that. So N-acetylcysteine or NAC is an essential ingredient for the kidney cells to increase their glutathione synthesis, and whether administered intravenously or orally, NAC supplementation is shown to help reverse the loss of kidney function and reduce inflammatory cytokines in these high-risk kidney disease patients. But it's not only supplementation with N-acetylcysteine that's been shown to raise kidney levels of glutathione and reverse kidney function decline from various causes. Supplementation with other natural agents that raise glutathione levels have also been shown to be effective. So these would include alpha-lipoic acid, silymarin from milk thistle, and L-glutamine, which is an amino acid. In addition to raising glutathione levels, some of these nutrients provide additional types of protection. For instance, alpha-lipoic acid also acts as a direct antioxidant in kidney cells, quenching free radicals. The same is true for the silymarin flavonoid from milk thistle, and it has cell rejuvenating effects that have been shown to improve the management of diabetes-induced kidney disease in humans. Other studies also show the importance of supplementing with coenzyme Q10 to protect kidney function as you get older, as well as taking a lecithin supplement that contains choline, probably 2 capsules a day, as I'll explain later. The choline in that lecithin will be converted into betaine within the kidneys, and betaine is a very important kidney osmoprotectant, helping to guard against kidney cell dehydration, which otherwise leads to cell death. So to make a long story short, by age 40 to 50, it makes sense to support your kidney glutathione levels by taking a supplement that contains a combination of N-acetylcysteine or NAC, alpha-lipoic acid, L-glutamine, and milk thistle that's standardized to at least 80% silymarin content. In addition to that, it makes sense to take some coenzyme Q10 as well, along with 2 1,200 milligram capsules of lecithin, which contains choline, which the kidneys will convert into betaine. Kidney function is typically screened for by blood tests assessing your eGFR, or your estimated glomerular filtration rate, as well as your blood creatinine levels. That's how your doctor knows if your kidney function is declining. Now, for individuals with established kidney disease, you should show the references I provided below to your specialist and ask for their consent to use these supplements to help stabilize and or improve your kidney function. So thanks for watching, and I'll see you next time.